We will now restore the distal buccal cusp of tooth number 19. That distal buccal cusp will be restored with composite resin. Of course, you would be performing your normal etch and chemical preparations prior to placement, but in this laboratory example, we'll not demonstrate the bonding procedures. Follow the bonding procedures per the manufacturer's directions for your particular bonding agent. We begin with the end in mind. The end is a cusp tip that restores function and aesthetics. The placement of the composite is in small increments so as to not cure too much of a bulk of composite and thus have a shrinkage away from one of the margins, as the composite does shrink very slightly when it sets. We'll place a small increment of composite into the preparation and use the condenser to carry the composite to the pulpal floor of the restoration. And I'm going to extrude a little bit of the composite above the plane of the cavo surface margin and then slightly shape it to contour at the buccal. Notice that I've left an area that's unfilled here so that this becomes our final increment, and if we had filled the entire cavity preparation, we have a greater risk of shrinkage. We're ready to cure that first increment. The intensity of your curing light will make a difference in the quality of the cure. It's better to overcure if you're uncertain about the time than to undercure. In this case, 10 seconds is the manufacturer's directions, and the intensity of light has been checked and the quality of the cure is assured if we know those factors. Our second increment is placed. Just slight overfill of the cavity preparation. In this case, I'm using the condenser again to pat the composite into place, and using the adjacent tooth anatomy as a guide, I slightly wipe the excess composite away. To avoid sticking of the instrument, we might coat our instrument with composite uncured resin. The liquid resin would then allow a nice release of the instrument so we don't pull the material away from the margins of the cavity preparation. We can take our time with composite to get it to the shape that we finally want it, and then it's time to cure again. In this case, 10 seconds, but again, know your manufacturer's recommendations. Now with an Explorer, we check the contours, and with articulating paper, we'll have the patient occlude into the composite to see if we are at a good point for occlusion. I note a little bit of excess composite, and we can use a finishing burr, 12-blade finishing burr, to bring that composite down to contour. Rechecking occlusion, and if we find that it's allowing the patient to occlude completely, this finishes the composite on number 19, distal buccal cusp.